Hi, I'm Denise. I'm a clinical specialist at St. Francis, and I'm here today to show you how to start an IV successfully. The first thing I want you to do is to gather up your supplies. In your PAR room, you're going to find an IV start kit that contains your tourniquet, your dressing, some gauze and tape, and all the things that you're going to need to start an IV. You will need to collect a stat lock to secure your catheter. You will get a J-loop, and you will pick up an IV catheter. And the size that you choose will be dependent on the purpose of your stick. Are you giving blood or IV fluids? And so that will help you determine what kind of size of catheter that you need. And then from your Pyxis, you also need to pull a flush, normal saline. So the first thing that we're gonna do after we gather supplies is go to the patient room. Hand hygiene, we're gonna gel in, do our hand hygiene, and go into the room. I'm gonna introduce myself to the patient and use all my AIDA tools. Good morning, I'm Denise. I'm here to start your IV. It's gonna take me about 10 minutes to do this procedure. Do you need anything or to use the restroom before we get started? Once you've accomplished that, your patient's gonna be at ease and you're gonna be ready to go. Make it easy for you and for your patient. So grab your clean gloves and don clean gloves. I'm not doing that today for the purposes of demonstration. Raise the bed height if that's more comfortable for you so that you and your patient are in the best position for success. Position your patient's arm at a good angle so that you can have an approach to the arm that is in line with the catheter. And I'll show you what that means in a few minutes. So once you're ready, we're gonna then open up our start kit. Remove the tourniquet and place the tourniquet on the upper arm. Be careful not to place your tourniquet too tightly. So bring the tourniquet up and loop it down so that it's easily removed when you have your successful IV stick. You don't want to place the tourniquet too tightly because we need to have venous return. If you place it too tightly, you also slow arterial blood flow, which in turn slows venous return. So you're not going to get a good puff up of your veins. Also, because there are nerves that run down the back of the arm, if the tourniquet is tied too tightly, you can give damage to those nerves in the back of that arm. The next thing you're going to do is find your vein selection and take your prep for the skin out of the kit. So I'm going to select this vein right here. I'll pop the prep, this chlorhexidine, and hold my skin taut. This is going to be a vigorous 30-second scrub, and I'm going to accelerate that for demonstration purposes. You want to do a fairly large area, and you need to be vigorous. The more vigorous, the better, because it removes dead skin and tissue from there. You can release the tourniquet at this point while you're readying your other supplies and your chlorhexidine is drying. Next, you're going to open and ready your J-loop. As I fumble with the package. So we will prime that with our normal saline. And lay it to the side. Next, we'll get our stat lock ready. And I'm also going to open my catheter and have it here. While my chlorhexidine continues to dry, let me just demonstrate the catheter a little bit for you. When you start an IV, you should always start the IV with the bevel of the catheter up or facing the ceiling. So if you advance the catheter just a little bit off of the needle, you will see that it is blunt tipped and it is not as long as the needle. And this is often where folks starting IVs fail because they get so excited by the blood return that they don't advance till the catheter is actually inside the vessel. So now let's move to the arm. Our CHG has dried now, and it's important that that dries before you start. We're going to reapply our tourniquet without touching the site, being careful to avoid that area. And then we're going to get our needle out at about a 30-degree angle. I like to hold above and below to secure the vein, keep it from rolling, and it also makes the skin taut so that the needle pierces the skin quickly and easily without dragging and being so painful for the patient. Without touching your site with your bare fingers now, you're going to put bevel up on the vein at about a 30-degree angle and quickly pierce the skin and into the vein. Now you see the blood return in your hub. You're going to drop your angle to about 15 to 20 degrees. Advance another millimeter or two, and then you should be easily able to push your catheter off and into the vessel. At this time, you would release your tourniquet, still careful not to touch your site. In the kit, there are sterile 2x2s. So we're going to place that under the hub of this catheter. Sorry, sticking to my fingers. And then we're going to take our J-loop that we've primed with normal saline. We're going to remove the needle from the catheter, discard it safely, and place our J-loop securely on the site. And then we can flush the IV. Do not touch this area when you're removing that catheter. Prepare with the gauze under here. Put a towel or a chucks under the patient's arm. But if you touch this area that you've prepped, you're going to contaminate your site. So once now you have it in flushed, you can remove the gauze, and we'll take our skin prep from your stat lock kit. And you're going to clean this here, and it is a sterile thing, so as long as you're not touching your fingers, touch this on the side to help secure your stat lock. Then take your stat lock, and if you open the stat lock and hold it in your hands just like this, it's much easier to apply. Gently remove enough of the backing that you can just see the two blue stiff points of insertion. Place it over your IV, and it snaps into place right on the top of the flange of your IV. Then you can simply lay these wings down and pull off, and your stat lock is secure. And the last step will be then to take your transparent dressing, peel off your backing, and place it over the IV site, including over the connections and the stat lock themselves. Peel away the paper topping. And now you have a label. So you should initial, time, and date your IV site insertion. You can place that over the hub of the catheter. And your kit also comes with tape. So then we would secure this and if you're not going to hook up fluids, close the clamp so that the blood doesn't backflow into your catheter. When you're finished with all of this, the last piece of the process is documentation. So you want to go to your avatar, click the location of your IV insertion, and fill out the required documentation according to the EPIC prompts. I hope this has helped you, and have a great day.